Hello Achievers, welcome to Team MDS Achievers, myself Dr. Vikram. Today we are here for the discussion on the topic of renal system as a part of our physiology. See, firstly, in the kidneys, the functional unit of the kidney is the nephron. Nephron, which is in a functional unit of the kidney, and each kidney consists of 1 to 1.3 millions of nephrons. See, firstly, you should know that why we have to study this topic. See, whatever the NSAIDs we give, or whatever the painkillers that we are suggesting the patient, uh, they are metabolized in the either liver or in the kidney. So, if any of the drug threshold limit has been crossing, then definitely it is going to end up in a renal failure. Because I have seen in my clinical practice only that like some of the uh, like uh, uh, some of the known persons only, they have taken in a painkillers in a very high number of rate. So thereby resulted in a kidney failure and resulted in death of the patient also, because the donor also not donor also, I think they didn't find the donor, appropriate donor. So thereby it ended up in the kidney failure and thereby patient died. So that is why we have to know the importance of the subject. And then see, diclofenac sodium or diclofenac, which is in a 40 mg or 50 mg, and a medical dose is about, so a therapeutic dose is about 300 mg is the maximum therapeutic dose that we can suggest the patient. Suppose like that means patient is got extracted or a patient is going for a root canal treatment. Then we have to suggest these painkillers, right? So definitely after the extraction we are be suggesting it, and they should be used only for the 3 days or to 5 days. That is 40 into 2 into 3. So how much? 80 into 3, 240. So 240 is a therapeutic dose, and it should not cross that limit at all. And if at all, if you're suggesting this drug in a for a long period of time, then definitely the patients might end up in the kidney failure, which is about some millions. That is like 16 lakhs or 25 lakhs of cost, right? And each kidney consists of about 1 to 1.3 millions of nephrons, and nephrons whose glomeruli lies close to renal medulla are called juxtamedullary nephrons. Nephrons whose glomeruli lie close to the surface of the kidney are called as cortical nephrons. That means the nephrons that lies close to the cortex is called as the cortical nephrons, and that are lying in this region is called as medullary nephrons. The functions of kidney are, that is homeostasis, that is the formation of urine, and hemopoietic function by secreting the erythropoietin. Endocrine function is by secreting the prostaglandin and kinins. And regulation of a BP, that is like blood pressure is maintained by regulating the volume of ECF and through the, that is RAS pathway, renin angiotensin pathway, and regulation of blood calcium. Okay. Thereafter, each nephron is formed by a blind end called as morphogen corpuscle and a tubular portion called as renal tubule. The function of corpuscle is filtration, which forms the first phase of the urine formation. That is, here you can see, to be much more precise, this is a nephron. Okay, and I know my drawing skills in this are very poor, but in the I can draw better in the kind of like that paper and pen. And then this is the afferent arteriole and this is efferent arteriole. So they do form a Bowman's capsule over here. That is, the capillaries along with a more the first part is called as a morphogen. That is called a Bowman's capsule, where the all the like urine formation, initial phase of urine formation begins. Okay, and this is the morphogen corpuscle, and this remaining part, the ductal part, is called as renal tubule. And then malphigian or renal corpuscle is formed by two portions. That is, tuft of capillaries called as glomerulus. That means the capillaries that are formed by afferent and efferent arterioles are called as glomerulus, and a Bowman's capsule which encloses the glomerulus. Tubular portion of the nephron is made up of three parts, that is proximal coronary tubule PCT, DCT, and distal that is a loop of Henle, right? See, this is a proximal coronary tubule. This is a first beginning end. See, proximal coronary tubule, then loop of Henle, and then distal coronary tubule, and there comes the collecting duct. The extraglomerular apparatus are, it is a specialized organ situated near the glomerulus of each nephron, and it is formed by macula densa, extraglomerular mesangial cells, and juxtaglomerular cells. The main function of the juxtaglomerular apparatus is the secretion of renin, and angiotensinogen is converted to angiotensin 1 in the presence of renin, and angiotensin 1 is converted into angiotensin 2 in the presence of ACE, that is angiotensin converting enzyme. Okay, and thereafter the angiotensin has three actions, that is constriction of systemic arterioles leading to the elevation of blood pressure, stimulates the adrenal cortex to secrete the aldosterone, which acts on the kidneys and causes a sodium retention. Regulation of glomerular filtration rate, that is GFR, is maintained. The urine formation includes three processes, that is glomerular filtration, tubular reabsorption, and tubular secretion. This glomerular filtration is the first phase of urine formation. That means the blood, the basic mechanism is the blood is carried to these capillaries. From there onwards, the urine, all the metabolites are being filtered into this Bowman's capsule, and thereafter this is collected into the PCT, and thereafter the tubular secretion and absorption will be conducted. That means sodium and potassium are absorbed, and potassium, see, at one phase sodium and potassium are absorbed, at another phase they are secreted, are injected into this urine formation station, so thereby resulting in the formation of an urine. That is, see here. Once the initial urine has been formed, the water has been reabsorbed. Glucose is absolutely reabsorbed, and amino acids, vitamins, salts are absorbed. And thereafter, once again, it is being secreted in the, that is like a sodium being secreted in the next tubules of the, and thereafter, the glomerular filtration rate is the total quantity of filtrate that is formed in all the nephrons in both the kidneys in a given unit of time. The normal value of the glomerular filtration rate, that is GFR, is 125 ml per minute, or about 180 liters per day. Okay, and thereafter formation of concentrated urine is the presence of ADH, that is antidiuretic hormone, in the distal coronary tubule, and collected duct permits permeable to water, resulting in a reabsorption. That means water being absorbed. So thereby concentrated urine is being formed. And the water reabsorption occurred by antidiuretic hormone is called facultative reabsorption of water. That means in the presence of ADA only, the water is being reabsorbed. Otherwise, the water will be secreted. So that's why it is called as a facultative reabsorption. Because see, facultative uh, microorganisms also you might have heard. That is like a, see, when oxygen is present, they take the oxygen, and when oxygen is not present, they carry out the aerobic reaction. Similar thing is happening over here. And the functions of the nephron are glomerulus, Bowman's capsule, PCT, and loop of Henle and DCT collecting duct. Each has any different functions. That is, glomerulus is concerned with the formation of the GFR. All the substances of the plasma except plasma proteins are filtered, and Bowman's capsule, a collection of the filtrate, is being collected, and the PCT, the most of the water, that is 65%, and salts are reabsorbed here, and glucose, bicarbonate, amino acids are completely 100% reabsorbed, and two-thirds of the sodium is reabsorbed in the PCT, and remaining one-third in other segments except in the descending limb of ammonium and H plus ions are secreted into the lumen. That means they are being secreted into the lumen, whereas glucose, bicarbonates, amino acids are being completely absorbed. And thereafter, loop of Henle, sodium and chloride are reabsorbed from the loop of Henle. And in the DCT, the potassium is secreted actively by sodium potassium pump in the distal convoluted tubule and collecting duct. Sodium, HCO3 minus and H2O are reabsorbed. Collecting data in the presence of ADS, the water is reabsorbed and absorption of sodium ion occurs. See, this is one of the very important slide that they can ask you because like at what stage what happens they can ask you. Thank you. This is Dr. Vikram signing off and always try to learn the subject, not read the subject. Don't try to mug up. See, some of the terminology we have to remember, but always remember the concept has to be remembered. Why we have to study, how we have to study, and what is the significance of each and every point should be first kept in the mind, and thereafter the process of studying should be started. Okay, thank you.